Welcome to How to Incorporate Nutritional Consulting into a Chiropractic Practice with Dr. James Machino. My name is Brad Whitehead, Program Director at Global Integrative Medicine Academy, your sponsor. A quick note, all who have registered for this webinar will receive a link to a recording of the webinar. Now let's get started. Let me introduce Dr. James Machino.
Good morning, everybody. Thank you for tuning in to this webinar. I think you're going to like it. Nutritional Consulting in a Chiropractic Practice. So just to give you a frame of reference, I graduated from Chiropractic College in 1979. And while I was building my practice in the early days, I went back to school part-time and did a master's degree in nutrition, which I finished in 1984. And the material was so compelling in the course that I wanted to include nutritional consulting into my chiropractic practice, but I really didn't know how to do it. And it took me many years actually to figure out how to do it in a way that wasn't overly time consuming, that generated profitability, and was impactful and was done in a way that was very responsible without slowing down the growth of my core chiropractic business, which was primarily treating patients that had musculoskeletal disease. So what I want to try to impress upon you today is how to do this in a chiropractic setting so that you can expand the service that you offer into an area that is greatly needed in society today. So without further ado, let's get started. Here's the premise of why I would have a seminar like this. And that is that in addition to musculoskeletal problems, chiropractors, who are we're the second largest health profession in the world. So you have the medical profession, then you have dentistry, which really doesn't count when we're talking about holistic health pertaining to the whole body. You can exclude dentistry from that. So we're the second largest health profession in the world when you look at numbers and where chiropractic has penetration. And we really are, based on our education, we're in the best position to guide patients to evidence-based nutrition and lifestyle interventions that can do some really important things to help improve the management of existing health conditions that people have over and above their tendonitis and their back pain and their disc herniations and the whiplash injury. Patients have other health conditions that they're challenged by. And on your intake questionnaire, you're picking up a lot of these conditions, but largely what chiropractors do, and I was guilty of doing the same thing for a long time, is just leaving it to the person's medical doctor and specialist to manage that from a medical standpoint. Where the evidence shows that, and it didn't always show this, it's really in recent years that we have compelling evidence to show that certain nutrition and supplementation and exercise and other lifestyle interventions can be a perfect complement to the medical management of 80 to 100 health conditions at least to help improve patient outcomes. So in addition to musculoskeletal treatment, using evidence-based nutrition and lifestyle interventions, you can help to improve the management of many health conditions your patients already have that are outside of sometimes their chief complaint. And you can also help them manage certain degenerative diseases and prevent them from occurring if they already are sort of on the downward spiral where they're showing risk factors for cardiovascular disease, or they're already diabetics, or they've already had cancer, and they want to know, is there evidence to show that if I do certain things, it would reduce the recurrence of cancer, prevent the cancer from coming back or metastasizing? Because this is the information that really isn't being provided by oncologists and by medical doctors, but there's strong evidence in the literature and in clinical studies to show that you can help people in this regard, and also to help them as they get older prevent dementia and osteoporosis. And other things show up where the person comes in and they have the person says to you, or you see on the intake questionnaire, that they have high cholesterol, or they have high blood pressure, or they have some other risk factor for disease, and the doctors are just putting them on medications. And the patient would love to know that if there's a more natural way that they could be approaching this that's synergistic to the medical approach, not in conflict with. A lot of patients would like to have that advice. They don't know who to turn to. And also you can help them, optimize their genetic health potential and also their athletic performance. Not just them, not just the patient who's interested in athletic performance. They have children who are playing hockey and baseball and basketball and lacrosse and soccer. And they would love for their child to have a professional consultation with someone who knows what they're talking about, who's highly skilled, that can actually give them a program to enhance their athletic performance and their lean mass gains, their explosive power. And where are they going to go and get this? They should be getting that, in my opinion, from a chiropractor that has an interest in this area, who has got some specialized training, and who has a passion to do it. And that's, if you're listening to this seminar, that's likely who you are. So, why is this even important in the first place? Well, the reason is that the medical profession, to a large degree, and there are some exceptions, they tend to ignore the evidence-based nutrition and lifestyle interventions that are shown to be important adjuncts in the health management and treatment of many health conditions. So often when the patient is under medical care only for all kinds of conditions, Crohn's disease, fibromyalgia, insomnia and sleep disturbances, recurrent depression, high blood pressure, high cholesterol, they're pre-diabetic, they have type 2 diabetes, they have lupus, they've been diagnosed with fatty liver degeneration, that usually they're just given the medical drugs or therapies to go with that. And the medical doctor or the specialist is not providing the nutrition and lifestyle information that's been shown in peer-reviewed clinical studies to be beneficial to improve the patient outcome. So the truth is that the addition of nutrition and lifestyle interventions that complements medical management has been shown to improve health outcomes for many conditions. And the patient is looking for this type of help in many cases, not just for themselves, but maybe they don't have the problem, but their wife has the problem, their sister has the problem. The CEO of our company came into my office today, and he said, Jim, a very dear friend of mine has lupus, and they're going through the standard medical stuff, but I would just love for them to come and see you, because I just know you could give them the nutrition and lifestyle medicine components that would be personalized to their situation. I said, absolutely. Have them book an appointment. That's what I do. And that's what I think more chiropractors should be doing. And the other thing is that just in the cases of musculoskeletal conditions, there's an underlying inflammatory state, there's underlying oxidative stress, poor muscle tone and bone density. These issues aggravate and perpetuate many of these problems of disability, and it requires an evidence-based nutrition and lifestyle consultation with the patient, a real sit-down session to get all the details, gather it, assemble the case, and then present it to the patient with a specific program. And I think most chiropractors would love to do that. They're not sure exactly how to do it, and they sometimes do it in a more offhanded way. Everybody has their own approach to it, but I'm going to show you what I think is the responsible, most impactful way to do it that is not time costly and is effective from a profit standpoint, because your time is worth something. So the question is, well, who's actually looking for this kind of help? I mean, this is just how many patients really would want this? Well, I will tell you, from my own patients, when I was practicing full-time for 20 years, and I was seeing 250 to 350 chiropractic patients a week for chiropractic core hands-on treatment, that once they got to the point where the chief complaint was resolved, I helped them. They came in the door with a problem, and I focused on the problem they had. I didn't try to explain anything else to them. They have low back pain, I'm focused on that. They have migraine headaches, I'm focused on that. They have a tennis elbow, I'm focused on that. But once the chief complaint is resolved and they have confidence in my skill and ability, then I say, one of the things that I like to do for my patients, if they want it, is to have a sit down and do a one-on-one nutrition and lifestyle consultation that would give you sort of a personalized program around what dietary advice would be best suited to your specific needs, what your exercise program ought to be based on orthopedic considerations, your age, your starting point, what your body fat is, your experience with exercise up to now, what your goals are, what supplements make the most sense for you. 7 out of 10 people are already taking supplements, but they're guessing what to take. And let's iron that out. And let's look at the other things that may be helpful, whether it's meditation, progressive relaxation. Maybe it's medical marijuana with high CBD to help reduce pain. That's chronic pain, or high THC to help improve sleep. But this is where you can get involved and do something that's really meaningful. And the thing is, you already at this point have a relationship with the patient. They came to see you with a primary complaint. Maybe they were afraid to see a chiropractor. They might have been reluctant, but they referred to you. You helped them. And as you help most of your patients, now you have a relationship and they trust you. So it's simply a matter now of taking it to the next level. In my experience, 50% of the patients that I offered that nutritional consult to said, yes, I would like that. Do you do that? I'd love that. And the other 50% said, no, this is not for me. I'm here for a good time, not a long time. I want to eat and drink and smoke and do whatever I want. I don't want any of this stuff. And that's totally fine. I don't want to talk people into doing something that they don't want to do. But 50% of the patients that come to your office, I will guarantee that if you gave them this option in something that made sense to them and it was understandable and was printed, they could read it, they would say, you know, I would like it. I think my wife should have this as well. And now you're picking up a new patient. So why over the years haven't chiropractors become more involved in this area? And it's for 3 reasons. The first thing is that some chiropractors try to do it and they find that it's very time consuming. And it's like, it just eats up so much time that it's in the way of my core chiropractic treatments. And the answer is simply that's because, just like me in the beginning, and I didn't know what I was doing, you need to have the solution is having a streamlined workflow with a workflow approach that is time effective. So you have all the right forms in place and you have a systematic approach, and then it's not time consuming. It's just you work that into your schedule. I'll show you how you do that. So a lot of chiropractors don't do it because it looks like it's going to take a lot of time to do this comprehensive assessment. It really doesn't if you are set up properly to do it. I'll show you how you do that. The second thing is I think it's not profitable. Well, here's what I would say. The average person on the street, if you said, you know, if you were willing to just do a little bit more part-time work to earn another $25,000 to $50,000 a year, would that be something that you would be willing to do? A lot of chiropractors would like to make another $25,000 to $50,000 a year working part-time, not having to use their body. Most chiropractors have never had this experience. Most chiropractors have this experience instead of the one I'm going to share with you. That is, I make money by going from this room to this room to this room to this room to that room to this room, and I use my hands and my chiropractic skills to treat people, and it generates revenue. And I do some orthotics maybe and support stockings, whatever else you might do, bracing. But most chiropractors have never had the experience. I'm just sitting down with somebody at a desk, just like a lawyer or an accountant or a financial advisor or an insurance advisor, and looking at the person's case profile and just with their brain and with just the exchange verbally, generating income just from consulting with people. And once you've had that experience, it becomes addictive. People are now paying you for your intellectual property. It's a beautiful thing. It's absolutely a beautiful thing. But you have to know how to work it in. The truth is that you don't start replacing your core chiropractic schedule by introducing nutritional counseling. You have to set up a separate time, as I will show you. And you start really small. You make that window very, very small. You're not going to start with 100 patients right away. But you'll see over time, you start building a whole separate practice and a separate source of income that can be, addictive. Now, the problem is not only is it the people, chiropractors think that it's time consuming, and it doesn't have to be, and that it's not profitable, because it is profitable. And as you get older, and I'm going to come back to this point, I will tell you, I'm now 63 years old. I'll be 64 years old soon. A lot of my colleagues who are still practicing full time say to me, my body's breaking down. I've got nodules in my fingers and my thumbs. My thumbs hurt, my shoulder hurts. I hurt my elbow. I've had shoulder surgery. My back is now bothering me on a regular basis. See, I can only work 3 days a week instead of 5 because it's hard on your body to be a chiropractor. And what's the pension plan? There isn't a pension plan. So starting as early as possible, being able to develop a secondary source of income from your intellectual property, doing nutritional lifestyle coaching and counseling, builds a secondary practice that just requires you to sit and counsel people that you can do long into your retirement years. That's what I'm doing now. And I'm getting referrals every day, not just from my patients, but from doctors in the neighborhood, nurse practitioners, other business associates. And that's because, quite frankly, I'm doing a very good job and a thorough job. And I have a workflow that says to the patient, this person really knows what they're doing. And then I can provide them with the research to support the things I'm recommending at my fingertips. And I can put all of that into your hands, by the way. You can do the same thing. I've already done the hard work. I can hand it to you. But the truth is that chiropractors, just from chiropractic college alone, are missing some of the key training that's required to cross the finish line. So chiropractic college, with all this great stuff, organic chemistry, biochemistry, nutrition courses, and medical diagnosis, differential diagnosis, and imaging and X-ray, and pathology, has laid an unbelievable foundation. You're 70% of the way there. All that's missing is some additional training on nutritional medicine and how to integrate that into the foundation of knowledge that you already have. No other health profession in the world has that solid foundation. Personal trainers don't have it. Physiotherapists, I'm sorry, they don't have it. Osteopaths don't have it. Massage therapists don't have it. Chiropractors have it. Nurses also have it. A lot of nurses are interested in this area now. But chiropractors really have it. And we also have the philosophy on health, about health optimization, not just, relieving, the symptoms of disease and the getting rid of pain. We're trying to optimize joint mechanics and optimize internal physiology. That's chiropractic thinking. That's why chiropractors embrace, as a rule, dietary supplements, whereas the medical profession, as a rule, they don't really embrace it very much. And they don't even look at the studies that are highly impressive. So the reason chiropractors are not more involved is they think it's time consuming. It's not. They think it's not profitable. Not only is it profitable, but it sets the stage for semi-retirement and retirement income for you. That's what it's doing for me. And also, they do understand, I think, that they're missing some of the additional training. They're not sure where they go to get it. And if it looks like it's too overwhelming, it's like, I just can't do any more education. I just too much to take on. I just don't have brain power for that anymore. But the truth is that this nutritional medicine information is so interesting and compelling that once you get into it, you can't put it down. So as a result, many chiropractors are half engaged. They do what I used to do. They give sort of offhanded advice around diet and supplements, just sort of in passing. Oh, eat more fiber and take some antioxidants. Oh, ginkgo biloba is good for that. Oh, if the person has this, try them on some 5-HTP. It's just sort of these, here, I've got a supplement for prostate. This can really help you. Without really understanding the whole case profile. What's the PSA level? What's the dietary factors? Are there other inflammatory markers in the diet? What's the vitamin D blood level? Before you start just throwing things at people, it's better to take your time and do a stellar job, because chiropractors for the most part aren't. And so because they don't do a stellar job, then they sell some supplements and they give some offhanded advice. It's not impressive enough for the patient to start referring people in to that practitioner's office for that particular reason. But if you really do a more in-depth assessment, provide solid education and detailed programming and monitoring of results, now you become the topic of conversation. And then they start referring patients to you, because most people go to the doctor, or they should go to the doctor once a year, get their blood work done. The doctor says, yeah, this is good, that's high, we'll put you on this medication, and that's the end of it. But no doctor at the end of that says, by the way, here's the specific dietary program I want you to follow. Here's your specific exercise program. These are supplements that are going to be helpful. These are supplements that would be dangerous for you because they would conflict with the drugs you're taking or a health condition that you have. And here's some mind-body work that would make sense. And by the way, you need some chiropractic care. You might need some orthotics to stabilize some. That doesn't happen. But that's crucial in terms of long-term health management. And so chiropractors, in my view, should be more involved. We're the best qualified profession to step up and do it. And so I drive down the street and I see on the chiropractic signs on the street, the chiropractic offices say chiropractic and wellness clinic, chiropractic total health clinic, chiropractic holistic health center. But I know that they're not doing the job. They might be selling orthotics and they have some exercise equipment, but that's not wellness in what the modern era requires. The most important things that are going to prevent the person from developing a degenerative disease and what keeps their blood markers in the ideal range, everything from cholesterol to glucose to hemoglobin A1C to homocysteine, that keeps their body and their mind functioning at an optimal level and complements the medical management of health conditions. The most important things for the person to do is to have a diet that's customized to their needs, be on an exercise program that's designed by someone who knows their body, strength training, cardio training, flexibility, on the right supplements to counter the aging process and target certain health conditions, the mind-body work that can reduce stress, lower blood pressure, decrease cortisol levels, keep the immune system stronger if they need that, sleep management. How many people are sleep deprived? And the mental activity to keep opening up the neural circuits in the brain so that dementia doesn't set in, learning new tasks, learning new information. And then chiropractic care and orthotics and all the other great things that we do. And the chiropractic office can do all of this. And you're saying, well, gee, sounds a bit overwhelming. I'll solve this problem for you. Just stay with me. So the thing is that if you do it right, this is what you can expect. And this is my own personal experience talking. That is that if you do it right, you'll be filling a void in the healthcare system that is a mile wide. And when I say that, I mean teaching people how to get their cholesterol lower through diet and lifestyle and manage our autoimmune conditions and fibromyalgia and improve their Crohn's disease and their diabetes, kids that have ADHD and people that have recurrent depression and anxiety. Oh, mental health, we got to stay away from mental health. That could be dangerous. No, as you're going to see, in 55 to 65% of the cases, the very first drugs that they try to help treat depression fail because they have to guess what drug to give the person. Then in the second round, a high percentage of people fail the second round. 55% of people with depression, it only partially resolves. It tends to come back, it recurs. And same with anxiety disorders. And the reason that happens, and it's in the psychiatric literature, this is not from Prevention Magazine, this is right in their own journals, but they ignore it. And I will show you this evidence, that many people have certain defects in how they metabolize folic acid, or they have low serum levels of B12, or the receptors on the nerve cell membrane are not working properly. These are dietary factors that can change it and have changed it for many people. Or they need to actually make more of the neurotransmitter than their body can make, because most of the drugs slow down the breakdown of neurotransmitters, but you need nutrients that can help the body synthesize neurotransmitters and balance them properly. Only diet and supplements can do that. And so I'm saying that this fills a huge void, helping people with Parkinson's disease slow the progression of the disease. Do you know how grateful they are if you can do that? And the truth is, what I'm seeing now is that more and more medical doctors in my vicinity are actually welcoming this approach. Things are changing because they know themselves they have limited time to even talk about these kinds of things. And secondly, they know they don't have they're not trained in this area. And when they see the results the patients get, they go, you know, this is actually quite impressive. I mean, I'm not saying that I'm going to take the person off the drugs, but this other stuff that's going on seems to be helping. And so as a result, I get patient referrals from medical doctors and nurse practitioners for this particular service. And I will tell you that, I don't know if you can see this. I was just at the American Academy of Anti-Aging Medicine. They have great seminars. Thousands of medical doctors going to these anti-aging seminars now. And you have medical doctors writing these unbelievable textbooks now, like the one by David Rakel here, Integrated. This is a medical doctor. This is an example of a key textbook that really has a lot of the evidence-based science in it for the management of different health conditions. So it's not just pie in the sky stuff. Well, we think it helps. There's some experimental. There's clinical studies on human subjects to show there's a great deal of things we can do for people with all kinds of different health conditions. And for the most part, chiropractors are focused on just the musculoskeletal stuff. They see on the intake questionnaire the patient has other health conditions. They freeze it. Oh yeah, I should really. I'm not really sure what to do. Eat more fiber. It's just not targeted. And so, if you do it right, what you can expect is to fill a huge void in the healthcare system that's a mile wide, and patients will flock to you. The second thing is that once you help these people, you become the topic of conversation by the patient. That's what they tell everybody about. They go back to their Parkinson's disease group, because they're in these sort of support groups, and they go, hey, I've got someone you have to see. This person's unbelievable. They go back to their inflammatory bowel disease group, right? And they say, hey, I found somebody who's really over and above the medications and methotrexate, and I'm on Remicade. This person really has helped to decrease the frequency of I feel better, there's less inflammation, IBS, insomnia, high cholesterol, diabetes, children with ADHD. You can help them, but you can't just throw stuff at them. You have to understand the profile, look at the right blood work. Depression, anxiety. When you start helping people with these kinds of concerns, you become the thing they talk about to everybody, and then more and more people find you. And so you say, well, blood work, as a chiropractor, I don't like ordering blood work, or I'm not allowed to order blood work. You don't have to worry about that. I'm going to show you how that gets done. You'll get the blood work. You don't have to worry about ordering it. The other thing is that if you do it right, here's what you can expect. You can expect to add profitability. So I charge for an initial consultation, depending on the complexity of the case, $250 to $500 just for the initial consultation. So for you, that might not be a lot of money. Maybe that would be like chicken feed, and it's not something you want to do. But for me, that's I feel very gratified that someone would honor my time in that way. Now, if you start including weight management programming in there, and a lot of people need that, then you're going to add very quickly $3,000 to $4,000 worth of additional income. And the thing is, I have already designed for you all the materials, all the coaching, all the videos, everything you need to run that weight management program with a minimal amount of time and effort. So you can it's plug and play, it's turnkey, and people need it, they want it. And it's not just weight loss for the sake of weight loss, but people who are overweight are at high risk for diabetes and all kinds of complications, fatty liver degeneration, higher risk of Alzheimer's disease, kidney pathologies as they get older. People would like to lose weight if they could find a practical way that's not some extreme crazy approach, and they already trust you. And it also, when you do this, here's what else you can expect. If you've never done this before, it adds, for me anyway, tremendous personal gratification by helping people in this sort of new and novel way over and above my chiropractic skill set. And my chiropractic skill set is very good. But when I add this layer to it, and I sit with people one-on-one, and I go through their medical records and their blood work, and they fill out my forms, and I do my assessment, and then I put that together and give them a complete program that's customized for them. And then I monitor and track their progress and see over 3 months, 6 months, 12 months how their blood work is changing and the functionality they're getting back. It's very, very gratifying. And it's no one who's doing this on a large scale. This isn't being done to the degree that is necessary based on the stats we have in society. So what are some of the major health conditions where you're required to pitch in? Well, cardiovascular disease, which is now, after cancer, the second leading cause of death. Most of the risk factors for cardiovascular disease I'm sorry to tell you, their lifestyle, it's not genetic. In 90% of cases, these are lifestyle issues that raise cholesterol and blood pressure and triglycerides and glucose and hemoglobin A1C and homocysteine and inflammation in the blood vessel wall, the high C-reactive protein. This is the stickiness of the platelets. This is lifestyle. And so but you can't just say to the person, eat less fat. And you have to look at their actual numbers and look at what their risk looks like. Understand their diet in detail. Understand what their exercise program now looks like, what medications they're on. And then you put together a program the person can live with. It may not be the ideal program because they might not be willing to do the ideal program. But you have to start taking the first step in the journey and move the ball down the field. With diabetes and prediabetes, let me tell you something. In both Canada and the United States, 1/3 of the population is either a diabetic or a pre-diabetic. So in the United States, there's 100 million diabetics or pre-diabetics. And in Canada, there's 9 million diabetics and pre-diabetics. And 90% of the diabetics are type 2 diabetes, which is primarily brought on by lifestyle disastrous behaviors. Overweight, out of shape, too many carbs. The person's overweight and out of shape. And they're given all kinds of medication, and you see the drugs advertised on TV, bring your glucose down, manages hemoglobin A1C, blah, blah. Those drugs don't prevent the complications. Even people who are managing their glucose with the drugs, the risk of complications is still very high. Peripheral neuropathy, retinopathy, they go blind, their kidneys shut down, and 80% of those diabetics die of heart attack prematurely. And it is a very costly thing to manage. If you have diabetic patients, they need your help. You can't just rely on the dietitian at the regional diabetic center. I'm sorry. The job is not getting done. Somewhere there's a therapeutic bond breakdown. These people are not taking the nutritional lifestyle advice seriously because the drugs are emphasized. But this is a lifestyle condition, and someone needs to sit down with them, put the aggressive program in place, monitor them, hold their hand to the fire, make it fun, make it inspiring, let them see the results, let them understand that wellness can be an enjoyable experience. And it's that chiropractic mentality that allows that to come across. Complications of being overweight, look at them all. Kidney failure, Alzheimer's disease, osteoarthritis, gallbladder conditions, endometrial and breast cancer, colon cancer, even prostate cancer. When you help people lose weight, you're not just helping them lose weight because they want to look better. Weight loss is part of wellness. It's a key component of wellness. And so that person is overweight, you need to say, you know, I believe I can help you. And I've got a program in place that really is practical, reasonable. You're not going to starve to death. You just need to straighten out some parameters, and I'll monitor you. We'll work together. We'll make it happen. Maybe it's not the patient. Maybe it's the patient's husband or their wife or their kid who's, has childhood obesity, which is very common today. And then, of course, problems with bone density, musculoskeletal conditions. You know about this. And then, but with cancer, look what the National Cancer Institute has published in recent years. 70 to 90% of cancer is brought on by faulty dietary and lifestyle patterns. Most people think it's genetics. Well, it is in certain cases, but for the most part, diet and lifestyle create the genetic mutations or turn on the genes that actually induce the cancer's change. So teaching people how to prevent that's important, but I'll tell you what's really important beyond that. The person has a family history of colon cancer, breast cancer, or prostate cancer. And show me a family that doesn't have that. The person probably has a genetic susceptibility towards the disease. Their risk is higher. What you want to do is sit them down and say, listen, let me show you the evidence that would show you how you could best, most aggressively, manage your lifestyle in a way that would help to suppress the development of that specific cancer, whether it's prostate, breast, colon. They all have specific types of strategies. And the person says, because otherwise they're just going for early detection. They're going for colonoscopies. They're going to like PSA testing. They're having mammograms. It's all great. I'm not knocking it. That's important. Early detection is important. But teaching the person how to down-regulate those genes so they don't express themselves is just as important. And no one talks about it. Here's what else no one talks about. The studies that have been shown in recent years that people who are cancer survivors of breast cancer in particular, and colon cancer, how you decrease the recurrence of the cancer. So I've been treated for breast cancer. And what have they taught you about your lifestyle practices to help decrease the chance of the cancer coming back? Oh, they just told me they're going to monitor me every 6 months and, you know, I can just live my life. Well, that's not evidence-based research. The evidence-based says there are specific targeted things. When women do those things, their risk for developing recurrence is cut by more than 50%. Who's going to explain that to the patient? No one's doing it. So this is where you can step up and say, I would love for your wife to come and see me for a comprehensive nutritional assessment. I'll put it all together, explain to her all the steps and how it works, the mechanisms behind it, to help create the most aggressive program to help decrease the likelihood of the cancer coming back. We need that. And in the mental health area, I will tell you that particularly for depression and anxiety, you're not going to be the primary health care provider. But in cases where the person has cyclical depression or they're fighting anxiety for long periods of time, then I will tell you that there's an underlying nutritional physiological factor that's holding back the success of the drug therapy. I'm not just making that up. That's right in the journals of psychiatry right now. But the medical profession, to a large extent, is trained to just follow, what the drug research is showing. And they don't delve into looking at how the body's metabolizing folic acid. Is the person's body able to make the methyl tetrahydrofolate that's required to make serotonin and to make other neurotransmitters and to make the lipoproteins that are important in the cell membrane? Because when you can do that, the drugs work better. And what about deficiencies in vitamin B12? Many, many geriatric cases of dementia and personality change are linked to just a decline in vitamin B12 nutritional status. Why? Because as you get older, there's less stomach acidity. A lot of these people are on acid blockers, they're on proton pump inhibitors, they're on histamine blockers, they're on antacids because they have gastrointestinal upset, so they block the release of acid in the stomach, so now you don't secrete intrinsic factor, and then you can't absorb B12. Their B12 gets depleted over a number of years because you store some in the liver, but over 3 years you're going to deplete it. And then the brain needs B12 to make certain neurotransmitters. And so now that there's personality changes, they think it's dementia, they're given drugs. No one's checked their serum vitamin B12, which is becoming more routine, by the way. They are checking it more. And also there are certain nutrients that can help make the receptors on the cell membrane work better and to build better lipoproteins in the cell and improve nerve transmission and to synthesize neurotransmitters more effectively. And some are really good for anxiety and some are really good for depression. And some are good for bipolar depression and some actually make bipolar depression worse. You have to know what is the diagnosis. And you have to look at the lab work to see what is the person's red blood cell folic acid, what's their serum B12, what's their homocysteine, what's their methylmalonic acid. And you're saying, oh, this sounds confusing. It's very, very, very simple. We'll get to that. So here's a list of health conditions where you could be very impactful, right? People who are overweight, high cholesterol, high triglycerides, high blood pressure, intestinal ulcers, IBS, Crohn's disease, ulcerative colitis, celiac, gastroesophageal reflux disease, pancreatitis, skin conditions, different types of diabetes. You could go down the list. When you have an intake questionnaire and the person says, I've got low back pain and here's where the pain is, and that's what you're focused on, and they have these other disorders going on or a family history of colon cancer, breast cancer, they're a breast cancer survivor or a prostate cancer survivor. And you're ignoring all of that and just doing the musculoskeletal stuff. And I'm thinking, the chiropractor has such an ability to impact a change here that can be life-changing for these people, life-saving for these people. They're not going to get this information almost anywhere else. So if it's of interest to you to do this kind of work, how do you introduce nutrition and lifestyle counseling to your patients if you're not doing a really good job of it now? Well, as I said, you don't introduce this type of thing until you first have resolved the person's chief complaint. They came to see you for a reason. They have migraine headaches, low back pain, a whiplash, tennis elbow, plantar fasciitis, shin splints. That's what's on their mind. That's what you treat. You fix it. Once that's resolved and they have confidence in you, then you can say, you know, what I'd like to do with all my patients, if they're interested, is have a one-time nutrition and lifestyle consultation where I give you a customized program around what dietary approach you should be using specific to your needs, and also an exercise program, what supplements you should be taking, and any other interventions that would be lifestyle-based that would complement good medical management and help to optimize your genetic potential for health and fitness. And 1 out of 2 patients will say yes, and probably 1 out of 4 patients will actually just follow through. But you also should have a flyer in your office that explains your nutritional consulting service, so people can sort of read it in your waiting room. So you don't have to tell, they already know this exists, because maybe they don't need anything themselves, but you know, they've got a wife at home who's suffering with some Crohn's disease or fibromyalgia or terrible sleep disorders, or they have a child that has ADHD, and they've taken them everywhere. Every specialist has seen them, but the nutritional medicine part usually gets ignored. So first you have to let them know that the service exists, and then how do you schedule it? Well, you know, it's baby steps. You start small. You start scheduling appointments. You start just by say, you know, 1 morning a week. Oh, let me go back. You just maybe have 1 morning a week or 1 afternoon a week where you see your nutrition consultation patients. That's it. Tuesday morning. That's it. No other time. You don't mix it into your chiropractic workflow. That's separate. And you put it, and that initial consultation is usually going to be 60 to 90 minutes. So you might only see 2 people in the morning to get started with, but it becomes very gratifying to do. You might even want to start working a Saturday morning to do that. But in terms of your long-term thinking, as I alluded to earlier, as you get older and your body starts to break down, and it will, some more than others, you know, you need generating income from a consultation becomes a natural evolution of your skill set and your workflow capability. Now, if you're too busy to do this already because your chiropractic clinic has already exploded and you're spending every minute seeing patients doing hands-on work, bring in a younger chiropractic associate who, while they're building their practice, can start doing this kind of work on your patients. They can do the nutrition consult work. You just have to get them the additional training that's required. But over time, you may want to step in and do some of this yourself. It's a beautiful thing. And it helps in terms of the long term for the transition into these semi-retirement or retirement years. So you're doing less hands-on work and you're doing more consulting work, which is easy to do, and you're using your intellectual property. And this can really be, you know, your pension or your retirement income in your long-term plan. And that's really, to a large degree, what I'm doing now. And it's really fun. But the thing is, if you're going to do it, you want to do it in a way that's responsible, that the approach is impactful. The patient's really impacted by it. So how do you do it? Well, to make the thing work so that it's time efficient, cost effective, profitable, and you're doing everything in a responsible way, you need to have all the proper forms in place. So when they decide they want the nutritional consult, there's separate forms that they take home and they fill out that looks for health conditions where nutrition and lifestyle medicine could be helpful. And I'm not going to have time today to show you an example of that, but I already have these forms developed, and I'll show you how you can access them. You also need to have a proper nutrition exercise assessment of their current. You have to know what they're already eating, what exercises they're already doing. And you need to know, do they have any gastrointestinal issues to start with? Or do they have any food allergies or sensitivities? Do they have Crohn's disease or IBS or ulcers or celiac? Do they have some gastrointestinal thing, previous surgery? Before you start saying, you know, I think you should have more tofu. Oh, well, I'm allergic to soy. Oh, I should have known that. You need a questionnaire that picks these things up so you don't waste time and say things that are erroneous or irresponsible. The third thing is that you need to review the current drugs that they're taking and the supplements they're taking. And in terms of drugs, you know, for most chiropractors, even if you've been to chiropractic college and you've taken pharmacology courses there and toxicology courses, believe me, it wasn't practical enough. It's just not done well enough. So you need some additional training there, and I'll show you how to get it. So you understand the mechanism behind how the major classes of drugs work. what do calcium channel blockers do? What do ACE inhibitors do? What do diuretics do? What do beta blockers do? How do drugs for uric acid work? How do drugs work for depression and anxiety? What's the mechanism behind the drugs that work to improve glucose management in the diabetic? What are the drugs that are used in dementia and Alzheimer's disease? How do they work exactly? What's the mechanism? Because there's a whole bunch of drugs in those classes, but you need to understand the basic mechanisms through which the drug is working. That's all you need to know based on the class of drug they're taking. And then that will tell you what the doctor is trying to do. And he's, okay, here's how I can complement that to lower their cholesterol, lower their triglycerides, raise their HDL level, whatever it is you're trying to accomplish. But you need to have more knowledge likely about that than you have right now. And we'll come back to that. You need to do a physical exam, but it's really not much. Blood pressure. It'd be nice if you could take their body fat, because if you know their body fat, you can say, here's your body fat today. Ideally, this would be your body fat. Then using a simple formula calculation, you can say, when you get to this body fat that's ideal for you, this is how much you'll weigh. Now it gives them a goal. And also body mass index, waist circumference. If they have a neurological condition like Parkinson's or MS, you need to do sort of an additional neurological exam so you can then track progress there. And then you want to review the blood work of interest. And this is where chiropractors become very intimidated. And there's no need for this. It just requires a little bit of additional education than you have right now. And what I'm saying is that you don't have to order the blood work. The patient is under medical care. They've already had the blood work done. The same way that you ask the patient to bring you any imaging results around x-rays, CAT scans, MRIs, and so on. You simply say, I need a photocopy of your most recent blood work, if it's been taken in the last year. Well, I haven't really seen a doctor for about 6 years. Well, then let me give you the blood work I like to have done. Before I do a nutritional consultation, this is the blood work that I like to see. Take that to your family doctor and say, I need an annual physical, and here's some blood work. I'd like to get these tests done. I'd like to get a copy of that. And the doctor will look at those blood tests and say, oh, these are just the standard ones that I do. It's not a problem. It's not a problem to get this blood work done. You don't have to order it. This is what people are entitled to every year at their annual physical exam. But I will tell you this, when that blood work comes into you, and you're looking at their other forms, you do the exam, when you sit with their lab results and you go down, so you're looking at it with a different set of eyes. There's the medically accepted range for cholesterol and triglycerides and blood pressure and glucose and hemoglobin A1C and homocysteine and C-react. There's the medically accepted values. And then there's the ideal values for longevity. So as I go down that blood report, looking at everything from their thyroid stimulating hormone and all these other parameters we're talking about, I circle the things that are not in the ideal range for longevity. And then I sit the patient down and say, now I want to explain something to you. This is okay. This is not ideal. Your PSA level is 2.5. Doctors will usually don't get excited till you get to 4 nanograms per milliliter, but at 2.5, there's already a good chance the cancer is there or will develop at some point soon. We need to get this PSA trending down. We need to get it under 1.0. Oh, no one told me that before. Well, you mean I can change my PSA? Yes, you can change the PSA. Now, looking at your dietary form and looking at your blood work and so on, I see here's how we're going to have to do this. So I want you to pay close attention, because over the next year, I want to get that PSA from 2.5 down to under 1. And the same thing with cholesterol or triglycerides or uric acid, whatever it is, in addition to whatever the medical doctor is doing. Some of these values we need to change through nutrition and lifestyle medicine. You have the power to do it. I'm going to help you. They can't believe it. And then when they follow the advice you give them and they see the numbers actually change, they're astonished to see that through their own personal behaviors, they can change their metabolic profile. Because we're such a drug culture. They're astonished. I think it's all built into them genetically. They're astonished to see the changes. And when you start looking at their blood work as part of the initial assessment and you can explain things to them, it just requires a little bit of additional training. It's easy. And once you can walk them through that and explain the things you're not happy with and how we're going to change it and how to fit it into their lifestyle, it establishes a whole new therapeutic bond. You're not just Dr. Joe, the back cracker, the chiropractor, the bone cruncher. Now they see you as a real doctor, as an equal in the healthcare system to any medical doctor or specialist. Not that you're better than anybody else, but you have a niche that they now start to rely on, not just for themselves, but for anybody else who they care about. They want them to see you. And that's fun. So what are the recommended blood tests? I've listed them here, and they're just standard CBC, glucosamine. It's all the standard things that a medical doctor is going to check anyway. But your interpretation of some of these things is going to help people understand not just what is the medically accepted range, what's the ideal range, and how do you use nutrition and lifestyle medicine to move the ball down the field, not just drugs. Because a lot of people would like to lower the medications around or reduce them or eliminate them. And if you can show them nutrition and lifestyle things that help to do that, then their doctor can decrease the dosage or decrease or eliminate certain drugs if they're no longer necessary. So all of this requires additional training to establish a true expertise and the confidence that you need. And you need to write patient forms. You need to write the required educational materials. I have all of it. In 1 hour, I can't give it to you. But what I did do is I developed that course that allows you to become a registered orthomolecular health practitioner through the Global Integrative Medicine. It's a fast track program to take chiropractors from, they're just 30% of the way to the finish. Now, they've gone around the track, and they're 70% of the way to the finish line. This takes you that last 30% of the way to become a true expert, so you can develop a secondary designation as a registered nutritional consulting practitioner or a registered orthomolecular health practitioner. I use the ROHP mostly, with that registration number issued to you by the International Organization of Nutritional Consultants. Sorry, my throat is, sorry, that's better. And once you have that ROHP and you have the registration number, when I'm doing nutritional consults now, I don't give the person a receipt with my chiropractic registration number on it. I put on my ROHP registration number. And 50% of the time, the insurance company will honor that. And it opens up a whole new window for profitability, reimbursement, and new services. So what does that course look like? Well, the course, it's an online course. You watch my videos, and it's all right there at Buda. You get all the course notes handed to you. You do the exams at the end of each course, but you can do it at your own pace. So the course 1 is sort of essentials of nutrition and metabolism and theories of aging. Course 2 is all the courses on nutritional medicine and neurology. Course 3 are the subjects on nutritional medicine and metabolic health, part 1. And then a nutritional medicine, metabolic health, part 2. And you'll see in here essentials of pharmacology and the ideal blood test for longevity. And then nutritional medicine and reproductive health, weight management, and sports nutrition. So you're going to get a sports nutrition expertise as well, so you can deal with those athletes. And in the weight management course, I show you exactly how to run the weight management program and give you all the videos you need for the educational segments for the patient, all the forms, all the tracking forms, all the educational stuff. So it's already just turnkey. You plug it in, and you spend 10 minutes with the patients once a week. You weigh them, you get them the next segment, you follow what they're doing. All the education's already built in. They know what to do. You're just holding their hand to the fire. And then course 6 is nutritional medicine and cancer, gastrointestinal disease, and functional. So I show you what the adjunct of nutritional management is in cancer and prevention of cancer recurrence, the gastrointestinal management, and also how you do that comprehensive nutrition lifestyle assessment. So you're saying, wow, how does this work? Well, the course is $3,000. If you pay for it up front, it's $2,700. But this option is very attractive to most practitioners. $250 a month for 12 months. Or $137 a month for 24 months. And a lot of chiros like this because it's very inexpensive. And they can finish the whole course in 12 months easily. So in the second year, while they're still paying off their tuition, they're actually generating income that pays for the tuition and the tuition they've already paid. So they're already generating profitability in year 2, even though they've only paid for half the tuition at that point. So it's a very attractive option. You say, well, how do I actually generate income if I'm a registered orthomolecular health practitioner? Well, as I say, through individual consults for people that have specific health conditions. I see a lot of Parkinson's patients. They pay me $250 for the initial consultation. Then there's follow-up, of course. I have a Crohn's disease patient booked tomorrow. I have a patient with lupus booked next week. Lots of type 2 diabetes patients being referred to me by medical doctors now and by nurse practitioners. People with chemotherapy-induced neuropathies, people with concussions, individual consultations for health conditions. And then people say, I have high cholesterol. I'm on these drugs. I'd like to be able to know what to do so I don't have to be on such a high dose, or I could maybe get off the drugs. My triglycerides are high. I've been diagnosed with fatty liver degeneration. What can I do? These are one-time consultations to get them started. Or an athletic performance consultation. Often they're children, they're athletes. They want to know, they'll spend $250 to help their kid get on an ideal program for optimization of their performance. Cancer survivors, see them and help them. Kids with ADHD, lots you can do. People with mental health where they need adjunctive help for depression and anxiety because the drugs alone are not stabilizing it, you can step in. Running a weight management program, the person pays an upfront fee of $600 to $900 for a 10 to 12 week program. That's already money in your bank account. And as I say, it's a turnkey program. You just plug it in and do it. You pick up 5 new patients a month. It's $3,000 to $4,000 right there of new revenue coming into your office. And also you can do other things that I've done to generate income with my nutritional expertise, because after that course, you'll have it all. And you can get paid to give lectures, lunch and learns for different corporations, different community groups, and special interest groups. Special interest groups, the ADHD local parent group will bring you in to do a talk. Parkinson's disease patients will bring you in to do a talk. The arthritis community will bring you in to do a seminar. You can charge for your time. I charge usually $500 to $2,000 depending upon the group. And it's fun to get paid to speak, by the way. And you can run your own continuing education seminars for health and or fitness professionals where you're charging $250 to $350 a person. And let's say you get 20 participants, it's $5,000 of gross revenue coming in. The thing is, if you're just a chiropractor with a bachelor's in science, you're not going to get these gigs. People aren't going to take you seriously enough. There's nowhere in your credentials that says I'm a nutrition expert. But once you're a registered nutritional consultant practitioner, a registered molecular health practitioner, and you can demonstrate this type of expertise, then you're on the road to a whole new window opening up. So that takes us pretty much to the end. I hope this was inspiring. I didn't mean for it to be totally self-serving. I just think that after my 35 or 37 years of being involved in this area and teaching nutrition courses since 1984, following the research very carefully, putting together this continuing education program that's targeted for chiropractors, just to get that fast track to the finish line, that missing 30% of knowledge and forms and expertise and workflow, that has tremendous value for our profession. We could be helping so many more people prevent degenerative disease, help manage conditions, prevent the recurrence of cancer, help their kids have healthier lives, optimize athletic performance, and help you transition into a professional experience over your professional career where you're starting to generate revenue just from your intellectual property, doing consults with people. It's a very rewarding thing, as well as doing seminars if you want to do that, and getting paid for it, not free lunch and learn, getting paid to provide your expertise to people. So I want to thank you again for your time. If you have any questions about this, because I developed this, then feel free to contact me personally at Dr. James at gim-academy.com. So thanks for tuning in. I really appreciate you giving me this time today. I hope I inspired you, and I hope to see you at some future webinars. Thanks very much. Bye.